Hey guys, let's talk about something that could be a game changer for many of us. If you've been using hair growth drugs or treatments for an enlarged prostate, you might want to pay close attention. There's new research that suggests these medications could have some pretty serious side effects, specifically erectile dysfunction that lingers even after you stop taking them. A study from Northwestern University found that men who took drugs like finasteride and dutasteride had a higher risk of developing persistent erectile dysfunction, or PED. And get this, the problem continued even after stopping the medication. We're talking months or even years here. Now let's dig a little deeper. The study showed that men with longer exposure to these drugs were at a higher risk. This was especially true for younger men under the age of 42. In fact, those with more than 205 days of exposure had a 4.9-fold higher risk of PED compared to those with shorter exposure. Erectile dysfunction means having trouble achieving and maintaining an erection sufficient for sex. The study found that this persistent erectile dysfunction continued despite stopping the drugs and even despite taking medications like VIAGRA. Before this study, there wasn't strong evidence that finasteride and dutasteride could cause sexual problems that continue after stopping the drugs. But now, the game has changed. Stephen Belknap, a research assistant professor at Northwestern University, said that the study clearly shows the risk of persistent erectile dysfunction with these drugs. Finasteride and dutasteride are male hormone blockers. They block the conversion of testosterone to its more active form, 5-alpha-dihydrotestosterone. These drugs are commonly prescribed for prostate enlargement and baldness. You might know them by their brand names: Propecia and Proscar for finasteride, and Avodart for dutasteride. There's even a combination drug called Jalin, which includes dutasteride and tamsulosin. The association between these drugs and persistent erectile dysfunction should be a wake-up call for both doctors and patients. If you're considering or already taking these medications for hair loss or an enlarged prostate, it's essential to weigh the benefits against the risks. Among the men studied, 1.4% developed persistent erectile dysfunction that lasted for a median of 1,348 days after stopping the drugs. That's nearly 4 years. So, what does this mean for you? If you're thinking about starting these medications or are currently on them, it might be worth having a conversation with your healthcare provider. Make sure you're fully informed about the potential risks and benefits. All right, that's it for today. Stay informed and always prioritize your health. Thanks for watching, and catch you in the next one.